The skincare ingredients on review is hydroquinone. The percentage of active ingredient on review is hydroquinone 2% over the counter and hydroquinone 4%, which is prescribed by the doctor. The dosage forms available are cream, emulsion, gel, and solution. Hydroquinone overview. Hydroquinone is a bleaching agent. Hyperpigmentation results from cutaneous inflammation, causing increased melanin production. Inflammation increases the release and oxidation of arachidonic acid to prostaglandins and leukotrienes, resulting in increased melanin production. Improvements with hydroquinone occur over several weeks to months. Hydroquinone acts as a skin depigmentation agent by inhibiting melanin synthesis. The cosmetic company recommended use are the following. It is used as a standard depigmentation and skin lightening agent. Clinically, it is used to treat dyschromia, solar lentigines, freckles, and solar post-inflammatory hyperpigmentation. Melasma and chloasma are example of dyschromia. Its most common use in patients with post-inflammatory hyperpigmentation and melasma. Common causes of post-inflammatory hyperpigmentation are acne vulgaris, eczematous dermatosis, contact dermatitis, psoriasis, lichen planus, and burns. The most common cause of hyperpigmentation results from photodamage from sunlight exposure. Hydroquinone is used to treat post-inflammatory hyperpigmentation along with photoprotection. The cosmetic company recommended application. This is used externally. Hydroquinone is only used topically as a depigmentation agent. A thin layer is applied with fingertips and rubbed into the face 1 to 2 times a day for 3 to 6 months. If there are no results after 2 to 3 months, hydroquinone should be discontinued. It is essential to evenly apply hydroquinone over the entire face to prevent uneven pigmentation and use it concurrently with sunscreen to protect from damage in UV light, which increases pigmentation. Physicians recommended stopping treatment after this time for a few months before restarting to decrease the risk of side effects. It can also be applied during weekends only or 3 times a week for more extended maintenance therapy with minimal complications. Multiple studies have shown that maximum results occur when using hydroquinone as a combination therapy with a retinoid and corticosteroid. The most widely used triple combination cream is composed of hydroquinone 4%, tretinoin 0.05%, and fluocinolone acetonide 0.01%. Use in combination with other agents requires a prescription by a dermatologist. Results vary among each patient. About 35% to 45% of hydroquinone is absorbed systematically after topical use. And do not apply more than the recommended amount. Do not apply on the skin. If you have an allergic reaction or hypersensitivity to hydroquinone. If you have an allergic reaction to the ingredients. If you are having too much sun exposure and not wearing sun protection or applying the right sunscreen. The use of this drug requires caution with other medications that cause photosensitivity. If you are pregnant, please consult your obstetrician first. About 35 to 45% of the topical hydroquinone dose is absorbed systematically. Current studies have not shown an increased risk of malformations or adverse effects in pregnant women, but it is recommended to minimize exposure due to the substantial absorption. The safety of breastfeeding mothers and children remains unestablished, and as such, breastfeeding females should avoid this drug. For long-term irritation, please discontinue the use of this medication. If acronosis develops, stop using hydroquinone and consult your doctor. Do not use more than the recommended amount. There are animal report studies with malignancies if hydroquinone is used in large oral amounts and for an extended period of time. The common side effects of this active ingredient are the following: irritation, allergic contact dermatitis, erythema, inflammation, xeroderma, stinging, and, rarely acronosis. Acronosis is a blue-black or gray-blue discoloration. It is rare and more commonly seen in patients that use a high concentration of hydroquinone for a long period on large areas of the body. There has been no confirmation regarding concerns that hydroquinone cream is carcinogenic either in clinical practice or human research. In the lab, studies also suggest that hydroquinone can falsely elevate capillary glucose when measured with a glucometer. In the environment, hydroquinone is a chemical and can be toxic in human and industrial activities by promoting the generation of reactive oxygen species, oxidative stress, and hence the potential for DNA damage. It is a major benzene metabolite and is known to be hepatotoxic and carcinogenic in this setting. Some studies suggest that it can promote tumor cell growth and suppress the immune response. Other reports on hydroquinone are the following. Squamous cell carcinoma has also been reported. Systemic absorption may cause peripheral neuropathy, fish odor syndrome, and fetal growth retardation. Here are ways in storing this product. Store it in a cool, dry place and not in direct sunlight. Store it at temperatures not exceeding 30 degrees centigrade. And remember to keep this product away from children. Other recommendations when taking this active ingredient. Do not use more than the recommended amount. Decrease exposure to UV radiation. Exposure to UV radiation is the main factor in pathogenesis, as UV radiation increases alpha-melanocyte-stimulating hormones and adrenocorticotropic hormone levels, which increases the proliferation of melanocytes. Factors that play a role in the pathogenesis of melasma are darker skin, UV radiation, hormones, genetics, and anti-epileptic medications. Estrogen also induces the release of melanocyte-stimulating hormone, or MSH, which stimulates tyrosinase, leading to increased melanin production. For this reason, melasma causes more frequently in female than in male subjects. Health and safety tips: decrease the exposure to UV radiation. Use broad-spectrum sunscreens. Hydroquinone is not FDA approved due to its unknown safety profile. It is banned in the European Union, Australia, and Japan. In South Korea, OTC hydroquinone has been banned by federal regulations. In the United Arab Emirates, OTC hydroquinone concentrations greater than 4% are banned. Hydroquinone may falsely elevate capillary glucose when measured with a glucometer. Avoid using it when you're breastfeeding or when you're pregnant. It is important to monitor patients to ensure that they only use the medication as prescribed for no more than 5 to 6 months to limit side effects. If any irritation, hypersensitivity, or allergic reaction occurs, then the patient should be instructed to stop the medication. The rare, yet most potentially harmful, side effect of achronosis needs to be explained to patients using hydroquinone, and they should be instructed to discontinue this medication immediately if this occurs. Please keep this in mind. Love the skin you're in. You only have one skin, do not experiment on it. Thank you for listening to this video presentation.